Another big question that patients like to ask is, what are the precautions after surgery? Once they get home, what can and can't they do? Number one of the most important things is we don't want you to get your incision wet for 2 weeks. So you will have a bandage over your incision, which we would like you to change, every day, once a day. We'll teach you how to do that. If you have home health, they will come out and actually change your dressing for you. Usually home health nurse will come out 3 times a week. They'll look at your incision, they'll make sure the dressing looks appropriate. But again, we really just don't want you getting that incision submerged underwater for 2 weeks. Some patients get creative and they figure out ways to wrap it with, certain like cellophane type wraps, anything that they can find that's water resistant. That way, you can still shower, but your incision's not getting wet. Another important thing that patients like to ask is when they can drive. Usually most patients drive in between the 4 to 6 week mark, but every patient's different. Some people can drive before that, some people it takes them a little longer. We also really want you off of your narcotic pain medication before you drive. So we don't want you taking narcotics and then getting behind the wheel. That's very important. Some specific precautions for knee replacements is, like I said, don't get the incision wet. We really don't want you kneeling on that knee replacement because that can, hurt your incision. We really don't want you doing any high impact activities after your knee replacement. We don't want you running, we don't want you jumping, but you can walk as much as you want. You can do physical therapy, but really anything high impact on that knee replacement and kneeling are the main precautions that we want you to take after a knee replacement.